Now, the spread of inaccurate information, confusing rumors, conspiracy theories, and improbable cures is a fairly common feature of epidemics. However, the prevalence of internet-related technologies and social media has made inaccurate information easier to access and harder to regulate. On this panel session, we're going to discuss how individuals and institutions manage uncertainty during COVID-19. We're going to look at the highlights, the role of information and misinformation during COVID-19. We're going to also explore the role of public trust in the effective crisis management. Now, allow me to introduce our guest for today, Dr. Gilberto Lopez. Do we have Dr. Gilberto Lopez? I hope I pronounced it well.
Hello, can you hear me?
Oh, Dr. Gilberto, welcome. And thank you for sparing time to speak to us today evening.
Thank you for having me here.
Yes, to just give you a little bit of background about Dr. Gilberto. He's an assistant professor in the School of Transborder Studies at Arizona State University. His works apply social determinants and political economy of health frameworks to understand the health and well-being of immigrants, rural and racialized minority populations. As a broadly trained social scientist, he applies mixed methods of research to better understand the inequities that lead to disparities in cancer, mental health, and infectious disease, of course, such as COVID-19. Now, Doctor, can we go straight into it? Talk to us about where you work, what you're working on currently, and why you're doing it.
Yes, thank you. Again, thank you for having me here. I was hoping I could share my screen. I did want to show a couple of animations, cartoons that we're doing. I don't know if that's possible. I'm not allowed to share it at the moment. But so we work here at Arizona State University looking at the Latino community, Latino immigrants or immigrants from Latin America in the United States. There's a history of over 100 years of migration from Latin America. And we know that when the pandemic hit, it disproportionately hit the racialized and minoritized communities here in the United States, with the Latino community being one of the most affected. They're the ones that had the highest rates of infection with COVID and among the highest death rates of COVID. So what we're doing, we're using the arts, combining the arts and the social sciences to create messages, to address a lot of these issues that you just mentioned in the introduction about misinformation and disinformation. So that's the project that we're working on at the moment.
Supposed to use that in your work, and what impacts have you seen so far?
I didn't catch the first part. I'm having audio issues. Could you repeat that?
Why did you choose to use animation, and also what impact have you seen so far?
Yes, so I am, on a personal level, I come from a farm working immigrant community here in California. When the lockdown happened, when the pandemic first hit, I realized that the information that was coming down to my immigrant farm working community was completely different than the information coming through to my academic and public health bubble. So I decided, I need to do something about this. So what we did, we decided to use the arts using, cartoon characters, which I'll show in a minute, to get the information out to a community that has very low formal education. There's an average education level of 5th grade, 6th grade, 6-year education in this community. So the status quo, the information, the materials that were coming down to this community were not enough. It was not enough. So we decided we need to get this information in culturally tailored ways for the Latino community in the United States. I believe I'm allowed to share my screen now. If you don't mind, I want to share one of these animations to give the audience an idea of what it is that we're working with. Is that okay?
Right. you can definitely share your work with us.
Okay, give me 1 second.
They are going. Go and get back. They are going to chip you with the vaccine. They will follow you. They will track everything you do. Look, I'm so upset about this. My temperature is 102 degrees. Oh, Terrigo. There are no chips in the vaccine. Stop spreading false information on social media. If our community doesn't take the vaccine, then the virus will bounce from body to body, creating new mutations, which may become resistant to the vaccines. That's why everybody needs to take the vaccine. It trains your immune system to fight the virus. The vaccine contains something that looks like part of the virus, but is not the virus itself. Our bodies learn to recognize it and learn how to fight it. This helps our body make something called antibodies that can attack and kill the real virus before it starts to spread. So make sure you go and get vaccinated. Rigo, the doctor is right. Stop spreading nonsense. Nobody wants to track you. And if they did, you put everything on the internet already. Put that thing away and come have some frijolitos con nopales.
Now, these are really interesting work we're seeing. And a lot of times, I'm just going to look at a bit of challenges because most of the time, I watch cartoons, animes literally every single day. But then at times as well, people ask me, why do you watch these animes? Because they are for kids. How much do you think the information reaches the people that you think you're targeting? And tell us also about the challenges that you actually face when you're trying to spread the message through these cartoons or animations.
Yeah, no, so one of the frameworks that we work with is this idea that humans, we're storytellers, right? We right. think in story, we think in narrative, in sometimes exaggerated ways of talking. It's how we express ourselves, especially in Latin American culture. We use storytelling across the world. So it's a very effective way. It's how we learn, it's how we exchange culture, it's how we keep culture alive. It's through storytelling. So it's a very effective way. This idea that cartoons are just for children, we completely disagree with. That's not true. So what we're doing, we collected data, we did surveys, we did focus groups, interviews. So everything that we put into these cartoons is backed by rigorous scientific and social science data. For example, the one that I just showed, one of the fears that immigrant communities were having here in the United States and continue to have is that the government is tracking you. The government is going to track you. They want to get you and they want to kick you out. They want to get you out of the country. And it's a legitimate fear. And there's a fear there's a chip in the vaccine. So we created this cartoon, and we have others, different topics. For example, pregnancy. Is it safe to get the vaccine as a pregnant person? Different themes that we're addressing with these. Again, and I think cartoons are a very good way to get information, again, to communities that have low formal education. We can't expect them to read these complex, needlessly complex brochures that the government puts out there.
Right. Now, we understand you've already explained to us how these cartoons, you get to impact a lot of people and how you don't believe that it's only for kids. But why do you think arts plays a key role in communities? Just to give a development based on your experience.
Yeah, so the arts, I think, I was talking to some other artists, musicians, and painters about our project, and what they were saying is, art, music, movies, even cartoons, these are things we go to when we have very special events in our life, whether it's we're happy, we're sad, we're depressed. All these times we resort to the arts. The arts is a way we express these successes and challenges and highlights and lowlights that we have in our lives. So it's a very fundamental part of our lives. Unfortunately, in our society here in the United States, at least it's taken a backseat to other, to the sciences, to the STEM areas. And the arts are kind of put in the back. But at the end of the day, we resort to the arts for comfort and for a feeling of community. It's the arts that allows us to have that and appeal to that human emotion. So it's a very powerful tool to use. So we want to use it to make sure that our community, the Latin American community in the United States, gets the information it needs. Because again, we're dying in disproportionately higher rates, and that is an injustice that shouldn't be happening. Just because someone is from a certain background, certain race, ethnicity, that shouldn't be a reason for dying earlier. So we feel like this, the arts is a very good way to address that.
Right now, you actually talked about how you use it, especially in the Latino societies there in the United States. We're looking at the crisis that happened, not only in the United States, not only in China, but this is something that happened all around the world, which affected a lot of people, not just one society, but actually a lot of countries, a lot of people. We saw people dying, we saw people getting sick. How do you say this has played a role during this crisis? And tell us how it also impacted you as an artist as well, a doctor as well, sorry.
Yeah, so I could speak, the work that I do, research is mostly Latin America, the United States, where we have, for example, a huge Mexican immigrant community here in the United States. And we have this transnational connection, ideas and goods and people are flowing back and forth constantly. One thing that we fail to acknowledge here is that there are communities in Latin America or across the world who have not even gotten the first dose. Here in the United States, we're already talking about the third dose, the booster shot. When our family members in Latin America still haven't gotten the first dose, they don't have access to it. So these are, again, some structural injustices that we need to acknowledge. And this comes into play, for example, when people go back during the holidays. There's a huge flow between Mexico and the United States during the winter holidays in December and January. And we're trying to make sure that those who go back are vaccinated. And the importance of being vaccinated, because you are going to a community where vaccination is very low. So that's one thing, again, we fail to acknowledge that we don't, in the United States, we are not the only country in the world. We're not the only people in the world. The world doesn't revolve, the sun doesn't revolve around us. And I think we're failing to really understand that and the implications of that. And again, that's where we bring in the arts. Me as a researcher, trying to address these inequities, and we're using the arts. We're trying to harness the sciences and the arts to make sure, again, that this message goes out there.
Ron, you actually mentioned some really good points there. And then this actually leads me to my next question, which is going to be our last question for this session. How do you envision the future of partnership between arts and health? Because this is something that we're seeing is something that can really work together. So how do you envision this future?
Yeah, well, I'm hopeful. I think, there's many projects like these emerging at the same time. And I think the sciences, and I'm talking in the research context, need to understand that there's power in the arts. The arts is not just this side thing, this extra thing that we do just for fun. No, the arts are as legit and as rigorous and as important as the hard sciences. And I think during COVID, a lot of projects like these, like the COVID Latino project that we launched, there's a hip hop one coming out of New York that uses the arts, uses music to get the message out there. And we're showing that it's very powerful, especially for these communities that have historically been ignored. We have historically been ignored in a lot of this health communication in the health sciences. and in programs trying to address the health of minoritized communities. And we know the arts work, and it's a very powerful way of addressing health inequities.
Right now, I know I mentioned this was going to be our last question, but just one last one, which I believe a lot of times we want to also reach out to the people upstairs, the governments as well. What would you say, what would you suggest for the government to do, especially when it comes to the partnership between arts and health? How do we put them together? What would you suggest for them to actually help when it comes to this?
Yes, so one thing, and again, I could speak to the United States context, is fund more people of color, more minoritized researchers, minority researchers. We have a story to tell. We have a passion to bring into this work because we are from these communities. And that's, I think that's a good start. That's where we need to start. Get more people from these communities that we're trying to, whose health we're trying to address, get them in to the research field, get them into the academy, funnel them through, because we have a huge lack of representation in almost every sector of society, and research and the sciences being one of them. So that's where I'm hopeful to have more people like us who are present and taking space in these in this conversation.
Well, thank you very much, Dr. Gilberto. It was really nice speaking to you and getting more insights from you, which all of you understood. You know, the voice starts with us and then it goes further. Thank you very much, Dr. Gilberto.